will bless you for that. So my leader, let's keep on keeping on. Let's be good leaders to our teams. Let's try to help our team to achieve, because the moment they become happy, automatically you are happy. If my team is happy behind me, automatically I'm going to be happy. If I help my team to achieve, automatically I'm going to achieve more. So good leaders, my fellow leaders, Dynapharm International across Africa, can you be please good leaders to our team? Let's stop being confused, because networks are still going to come. Every now and then there is this one coming, this one coming, this one coming. But don't forget that if you keep on running with networks, you lose what we have with something you don't have. Because they will always talk money, they will always give you reasons why you should leave Dynapharm. And me as Iris Maika CDM, I'll always say I'll remain in Dynapharm until my last breath, because I have seen reasons to keep me in Dynapharm. My products are very powerful. They will always keep me to be in Dynapharm. My marketing plan is powerful, will make me to be in Dynapharm until I'm still breathing. So, ladies and gentlemen, since I started my presentation late, I have a lot I can share more, but I think time is not by my side. I would like to say, let's keep on keeping on, my leaders. No matter how hard it is, how difficult it is, let's keep on keeping on. Be good pilots to our team, because God has a tendency of picking a nobody in front of everybody without consulting anybody. And God can only do that through your faith in your product, in your company. As Iris, Dynapharm took me from nothing to something, from grass to grace, from nobody to somebody. I really thank my directors for bringing Dynapharm in Africa. So as I conclude my presentation, I will always say, thank you so much, my leaders. Let's keep focused. Let's keep on keeping on, and have a nice day. Thank you so much. Hello? Hello?
Hi.
Hello.
That's the end of my presentation, my leaders. That's the end of my presentation, and leaders, until we meet at home.
Thank you so much.
Thank you so much, Iris, for that presentation. Is everyone hearing me?
Yes, we are hearing you.
Before we go to the next presenter, if you have one or two questions for CDM Iris, please go ahead. Is there anyone with a question based on the topic that CDM Iris has presented to us? If we don't have any questions at the moment, maybe we can move to the next presenter, who is Gershom, who will be sharing with us about health. Gershom, are you online?
Yes.
Consultant Gershom, please go ahead.
Thank you. Is everyone getting me?
Yes, we are.
Yes.
All right. Greetings, Dana from Africa.
Greetings
I'm called
to you.
Gershom Twehami, and I'm a consultant with Dynapharm International. It's a pleasure to be with all of you here. And thank you, CDM Iris Maika. I'm very happy to see you once again here. And Today, I would like us to share about the health dangers of poor blood circulation, because it is our best field regarding Dynapharm products. So, one, I would want each of us to understand what is blood circulation before it becomes poor or good. Then, you know what can cause poor blood circulation in the body. In the meeting room. I would want us to know, how do you know that you have poor blood circulation? After understanding what it means, then you understand how do you know. Then what are the simple ways that we can have to manage or improve our circulation of blood in the body? And then I would give a few recommendations of the products that are best regarding that condition. So first, to introduce to you blood circulation, it is the flow of blood. It is the flow of blood in our blood vessels generated by the energy of our heart, pumped through the blood vessels to the entire body tissues. So what is poor blood circulation? So poor blood circulation comes about when this blood cannot actually reach some of our body cells and body tissues. So the primary causes of poor blood circulation, we have accumulation of the regular cholesterol that you know. We have obesity, people with too much unnecessary weight. We have people with a very bad nutrition. Then people who are addicted to drugs like cigarettes, abuse of alcohol, because like the cigarettes have this nicotine chemicals and carbon monoxide. They usually damage our blood vessels and inhibit the flow of blood in the normal manner. Then we also have blood vessels that narrow, what we call atherosclerosis, and it also inhibits the flow of blood. So those are some of the causes that can cause a poor blood circulation in someone's body. So when the poor blood circulation happens, what are you limited to? One, our blood is very essential for transportation or supply of oxygen in our body. Two, it is supposed to remove all the wastes. As we talk about detoxification, you cannot detoxify when you have a very poor blood circulation, because how are the wastes going to move out of the body? Three, we have the hormones that move in the blood. We have nutrients. We have regulation of heat. So basing on the functions of our blood movement in the vessels, what are some of the dangers that you face? When you are inhibited from the flow of oxygen, you are going to get body cells dying, and this puts you at risk of organ damage. It's going to put you at risk of cancer just from a simple blood circulation. If blood cannot reach the liver cells, the liver is going to get damaged. Liver cells are going to die. Liver cells are not going to get oxygen. When there is no oxygen, there is excess carbon dioxide. The blood pH is going to become acidic, and the risks of cancer are going to go so high. And two, we have the wastes like lactic acid, which is supposed to be excreted like urea. So these are some of the unnecessary wastes that if blood cannot take out, they are going to remain in our bodies and affect you, especially in the muscles. So some basic symptoms you can know from this. There are people experiencing a lot of body fatigue, regular body fatigue. You rest, but the rest is not enough. You sleep, but you feel the sleep is not enough. You are getting daily fatigue. So it is an example of poor blood saturation. And some people are resorting to fast painkillers or dilators, which does not help us in any way. Then we have nutrients, minerals, we know them, calcium, iron, that is necessary for blood formation. When you're not having a proper saturation of blood, you're going to be deficient of these minerals. And that's how some people are going to lose the nervous function in the body. They'll complain of unending backache because we have messengers that are supposed to flow in the blood. We have calcium that is supposed to build our teeth and the bones. So you're going to be at risk of arthritis. And the other issue is immunity. Our immunity flows in blood. Even when you get supplements that boost your immunity, and they're supposed to be moved by blood, but the movement of blood is not proper, your immunity is going to remain compromised. So that's why you will always be wondering the variances in the community. You find a group of people, maybe say 10, working in the same environment. Only 2 people are getting regular infections, be it UTIs, be it the coronavirus, and you wonder that how come 2 people are infected and the 8 are not infected? So those are the minor symptoms that you can have and know that your blood saturation is not proper. And the other challenge is if you are consuming excess nutrients to boost your immunity, and they cannot be distributed evenly in the body because of poor blood saturation, then you're going to cause unnecessary toxicity to the liver and the kidneys. It is going to be an overload because the necessary nutrients cannot be distributed in the body. And to add on that, that's how even diabetes comes in. You find that someone is consuming the normal glucose levels in food, but because the blood vessels have been blocked with accumulating cholesterol or plaque, so there is very minimal absorption of this sugar into the necessary tissues that need the glucose. So what is going to happen? You're going to be tested with high blood sugar levels just because of poor blood saturation. And you're going to be at risk of stroke. The other challenge that we have when you have poor blood saturation, you are going to have unhealing wounds. You are going to have regular contamination of the same wounds, and your blood is going to fail to clot because our clotting factors are supposed to move in the blood. So when the blood cannot be saturated in a proper way to reach the injured site, so you're going to have challenges in clotting and you're going to lose a lot of blood, putting you at further risks such as anemia. So the other dangers that we can include, there is a loss of eye vision because we know the vitamins necessary for improving eyesight. The vitamins don't move on their own, they're supposed to move in the blood. So whenever they cannot reach the eyes, the eye vision is going to be affected. Then we have the heat intolerance, people who sleep at night and they are feeling too much heat. People who are during the day, you're at work, but you're feeling too cold. Heat intolerance and heat fluctuations. This heat is regulated by the movement of our blood in these vessels. So when there is a poor blood saturation, you're going to have challenges with management of heat in the body, and excess heat is going to damage the body organs. The other symptoms that we can look at, if you want to understand further that you have challenges in saturation of blood, we have rapid breathing. You do a light exercise, but you're breathing rapidly. That is a sign that you have limited oxygen. Oxygen is transported in our blood. Whenever we inhale oxygen, it is transported in our blood and exchanged in the lungs. So whenever you're having rapid breathing, that means you're doing a compensation of oxygen in the body. And whenever there is low oxygen, the carbon dioxide is high, putting you at an acidic environment in the body. Cancer works with carbon dioxide and acid. So you can always take note of that. Then we have people with swollen feet and varicose veins. These veins are veins that you can look at the calves or the ankles, swollen and greenish in color. When you are having challenges in your saturation of blood, you're going to have these varicose veins, and you're going to have muscle aches, you're going to have muscle pulls and other challenges in movement. There are people who get paralyzed. Paralysis is a symptom of deficiency of blood. Whenever these muscles are not getting the necessary nutrients and messengers that are supposed to enhance their contraction and relaxation, you're going to have challenges. Then we have people with an elevated heart rate. You're going to put your heart at a risk of working so hard to pump that too much energy, which further puts you at a risk of hypertension. Then we have numbness. You down, you cannot feel your feet. You hold something, you can have headaches and dizziness and fatigue, like I told you. Some people, you find that you are having headache and you're consuming a lot of these anti-inflammatory drugs. You're taking a lot of painkillers. That is going to further damage the blood vessels. There is already insufficient blood saturation and you're further damaging the blood vessels. On top of that, I would like us to know some of the simple remedies that we can have to manage these challenges. Basically at home, in a home environment. One, we have regular walks. Most of us, like CDM told us, most of them have already won their vehicles. Some of them are seated at home. So they do not have adequate exercises. We are moving in a vehicle day and night. So you're going to have challenges in blood saturation. Get time and have a walk, have an evening walk or a morning walk. Just short minutes, 20 to 30 minutes will be enough. The other simple indoor activities, drink sufficient water. Where possible, you can have a massage. When you wake up early in the morning, have a 2 to 5 minutes break of stretching the neck, the arms, the legs, the back, just to adjust on the movement of blood in the body. Then the other recommendation is you can have small light weights at home or even in your bedroom, just a minimum of 1 kilogram. Lift them once in a while. Tie them on the cuffs and move with them around your room. That will be very sufficient for you to improve the saturation of blood. Then those who have the bikes, you can ride a bike in your compound. These are non-commercial activities that you can do just to improve your health and the flow of blood. And to add on that, as Dynapharm, we have the products perfect for this situation to avoid the effects we looked at, the dangers of poor blood saturation. One of the best products we have is Jinko, the Jinko biloba. We have it in various forms. We have the tablets. We have the ginkgo and ginseng powder in form of coffee. We have ginseng capsules. We also have it in a powder form, ginseng honey ginger. We also have it in a coffee, various coffees. We have the green tea capsules, fat burners, reduce the fat in the blood vessels, reduce the obesity because these are external blockages to veins. They can cause a clot at any one point in the body. We have sea cucumber, very rich in omega-3, very good in building our blood vessels. Our blood moves blood vessels. We need to build and maintain our blood vessels with omega-3. Omega-3, we have it sufficient. So those having challenges, you are consuming too much, but not necessary for the body because of poor blood saturation. We should have a consumption of supplements with intent. It should not be taken for granted, because when you consume a lot of chlorophyll and you're not seeing a change, you should find out why. You are consuming a lot of vitamins, you are not seeing a change. You should find out why. So take a note at these products that will help improve your saturation, because these nutrients need to be distributed evenly to every body tissue. Because when the brain doesn't get nutrients, cognitive function and understanding is going to reduce. When there are no nutrients for the eyes, eyesight is going to slow down. When there are no nutrients for the hair and the nails, you're going to see deterioration, the skin, the kidneys, and the other body parts. So, as regarding blood saturation, I would like to invite a few questions on top of that. Then I'll be able to answer shortly. Thank you.
Thank you very much, Consultant Gershom. Leaders, if there's anyone with a question concerning the topic that has just been presented by our Consultant Gershom, please feel free. These presentations are here for us to learn, not just a one-way communication from the presenters. Over to you, leaders. Dynapharm?
Number one.
Number one.
Are we all there? We are sleeping. Please
We
go
are
ahead.
not sleeping. We have coffees with us.
Very good, very good, very good. Please go ahead and ask some questions to Gershom. As you organize yourselves, maybe I'll ask one question. Gershom, please highlight to us the foods we usually eat that lead to poor blood saturation, so that as much as we know the products we're supposed to take, let's also know the bad foods that we're enjoying that actually affect our blood circulation.
All right, sir. Thank you, Mr. Sike. Most of the foods that we have affecting the saturation of blood, one, we have the foods high in oil or fat, saturated fats. These build up plaque in our blood vessels, you know, the junk food, some of the refined oils. The other foods are foods that are high in salt and high in sugar. This directly damage our blood vessels and inhibit our flow of blood. Then we have people who are consuming excess alcohol. Some use alcohol as a food, so it becomes a challenge and you should expect poor blood saturation. Like I told you again, there are those who are using a lot of cigarettes and drug abuse. Those drugs are also directly damaging our endothelial cells. We have good cholesterol and bad cholesterol. So the good cholesterol is supposed to help us eliminate bad cholesterol. However, when you are having these intoxications in the body, you are going to have a challenge because they're going to eliminate the good cholesterol, giving a chance to the bad cholesterol accumulating in the blood vessels, which directly inhibits the blood flow. Thank you.
Yeah, thank you very much, Gershom. Anyone with a question or two concerning the topic? Hello?
Hello.
Hi.
Hello?
I have a question.
Yes, Mr.
Yeah,
Geoffrey.
someone has a question. Please go ahead.
Yes, my name is Yasima Geoffrey, Dynapharm Uganda, Kamu. Thank you so much, CK. Thank you, Gershom, for the teaching. You know, in Dynapharm, every day is a running day. Now, my question, Gershom, you talked of having swollen foot as a result of poor blood saturation, but you also have swollen foot as a result of eating too much red meat, and which causes gout, and the foot is swollen. So how do I differentiate that this swollen foot is as a result of poor blood saturation or is as a result of eating too much red meat, which is gout? Thank you.
Welcome. Any other question?
Any other question, please, so that Gershom can handle them at once. If there's no any other question, maybe Gershom, you can go ahead and respond to that.
All right. So Mr. Geoffrey is asking about of red meat and gout. Actually, of uric acid in our joints, it causes a painful and piercing sensation. This uric acid usually is a waste from our kidneys. After metabolism, there is a waste of urea and uric acid. And like I told you, these wastes are supposed to be taken out by our own blood through the kidneys and urine. Then, when you have a very poor blood saturation, these wastes are not going to flow the blood into the lower joint. So it is the poor blood saturation that will lead to the condition gout. Thank you.
Thank you, Gershom. Our leaders, any other question? Any question, leaders?
Can I supplement on
Yes, please go ahead.
saturation?
Please go ahead.
Okay, thank you. My supplement on saturation is we need to advise our clients, most especially if you get a pregnant women, let's always advise them not to sleep on their back. Because when they sleep on their back, the stomach pressure will lie on the inferior vena cava, which takes blood from the one which carries blood from the feet. And then it will mean blood will stay longer in the feet, and then you'll get a condition of swollen feet. Always. So we can always advise them to sleep on their sides. Then the other one is to advise everyone to always avoid eating big sums of food, because when the stomach is very full, it will press on the diaphragm up a bit, and then the heart will not pump normally. And at that point, we also get another one whereby you don't need to rush to bed after eating, because definitely the stomach will give some discomfort. It will push a bit on the diaphragm, and then your heart will not work like at peace. Then the last one, if someone is supplementing, let's always at least be active a bit. So that's my contribution on pregnant women. Advise them not to sleep on their back always because of that, and then not to take big sums of food at the same time, and then you rush to bed. I think that's what I can say for now. Thank you.
Yeah, thank you very much. Do we have any other question coming through?
Hello.
Hi.
My name is Bosco.
Yes, Bosco.
Thank you for this wonderful presentation. I would like to get some clarification from Mr. Gershom. What would be your opinion if ever somebody is using blood thinners, for example, warfarin, and also for people with bleeding tendencies? epistaxis, and probably those with the active ulcers. Would it be wise to recommend you ginkgo or the coffees with ginkgo and other combinations? Thank you so much.
I request you to repeat your question. It was not clear because of the network.
Hello.
Hi.
Yes, Mr. Gershom. Hello.
Please go ahead. Hi.
All right. My question is, would it be wise to recommend ginkgo for somebody who is already using blood thinners, and also in situations whereby somebody has bleeding tendencies, or people with active ulcers, people with epistaxis, and probably others experiencing hemorrhage of any other cause? Would it be wise? What would be your take on recommending ginkgo as one of the products that aid in blood circulation, as opposed to probably something which can boost the clotting mechanism in that scenario? Thank you.
If I sent it here and I ask you who is that, would you see the? Do you even see that face?
Gershom, have you got the question?
Okay, beside and you take a picture.
Yes, I've got it.
Okay.
So he's asking the challenges of administering ginkgo to someone using blood thinners and has a bleeding challenges with active ulcers. So ginkgo is as well an active blood thinner. So the purpose of blood thinning is to make sure that these clotting factors in the blood are distributed to the injured sites to activate the clotting and stop the bleeding. However, when someone is on blood thinners, you need to be careful before you administer the ginkgo. You have to address the effectiveness of the active blood thinners they are taking before you add on more blood thinners. However, for blood thinning to improve blood saturation, it is very proper because it enables the injured sites to access these clotting factors to help and stop the bleeding. And for ulcers, we have ulcers that are caused by bacteria, and some can easily get affected because of this bacteria. And whenever we have improved blood flow or thinned blood, then that means we are going to have enough white blood cells, we are going to have enough immunity accessing this bacteria, and they'll be damaged, improving the ulcers. So there is no challenge with that. Thank you.
Thank you very much, Gershom. Is there any other question? CDM Precious, are you trying to say something?
Yes, let her go ahead.
I don't seem to be hearing you. I don't know if the rest are hearing you. CDM Precious, please unmute your microphone.
CDM Precious, please unmute your microphone. We can't hear anything. CDM Precious, please. Okay,
yes,
thank you.
I'm on mute. Can you hear me?
Yes. Yes, we can hear you now. Please go ahead.
Okay. Good morning, everyone.
Good morning.
CDM Precious from South Africa. I've got this question to ask. In a situation whereby we got some patients who are taking ARVs, and most of them, they complain that each time they take the ARVs given to them by the hospital, that it weakens their immune system. So in that case, some of them prefer using our Dynapharm products So the challenge there is when they are taking the treatment from the hospital as ARVs prescribed by the doctor, are we supposed to also allow them to take the our food supplement at the same time? At the same time, because the reason why I'm asking, some of the clients they prefer, some of them they tell us that they prefer to use our natural products, okay, because it got no side effect. So now in that case, are we supposed to ask them to stop the treatment given to them by the hospital, or is there any stipulated hours or time they need to combine with our food supplement? So that's my question.
Thank you, CDM Precious.
All right, sir.
Thank you, CDM Precious.
Okay, thank you, sir.
Our clients who are on retroviral therapy, we are not supposed to stop them in any way from consumption of ARV drugs. However, we have the best supplements that are necessary for rebuilding their cells. For them to have a weak immune system, it is a must whenever you are infected with the HIV, because the virus continuously eats up the cells. So you have to have a compromised immunity. So in such a situation, whenever you're having the retroviral drugs that help on killing the viral cells, then you definitely need the supplements that will help on building more cells, because the more cells you build, the more regenerate tissues and the better the immunity. So you cannot stop them from the treatment, but then we need to add them the best supplements that we have for the clients who are on ARVs. The examples we have is ProLink that has natural immunoglobulins. We have spirulina. We have chlorophyll that will help on reducing the drug toxicity. We have goat's milk, very rich in vitamin B6. We have mangosteen, a very complete immune booster. So do not hesitate to give them any of our products. However, do not stop them from the retroviral treatment. Thank you.
Thank you, Gershom. Do we have any other questions?
Thank you so much for the answers.
Yes, Gershom, you mentioned about how poor blood circulation can affect the movement of minerals or nutrients to cells. Please, I need you to relate that to how it can affect the efficacy or the effectiveness of a product. How poor blood circulation
I'm not meeting
can
Zoom.
can affect the efficacy or effectiveness of a product.
I am tough forever.
CDM Precious, please mute.
CDM Precious, please mute your microphone.
Yes, can you hear me? Yeah.
Okay,
Yes.
Gershom, what I was saying.
Yes.
My question is, explain how poor blood circulation can affect the effectiveness of any other given product. If the circulation is poor of the blood, how does it affect the effectiveness of a product that someone will administer or prescribe to someone?
Okay, thank you. For example, I'll use the example of CDM Precious. She was asking about the immune boosters that we can give. So when you consume an immune booster and you need to generate new cells that can fight for the body, and you have a poor blood circulation that is supposed to move these nutrients in the blood and reach the necessary tissues and rebuild them. So whenever you consume a product with a poor saturation, these nutrients may not reach the targeted tissues. So the efficacy of the product really becomes a challenge. So usually when we recommend someone to start with a product like chlorophyll or ginkgo before adding on the others, that is what we are looking at. When you do the cleansing, when you reduce the weight of the blood so that it can move smoothly, it improves the distribution of these nutrients to the necessary body tissues that we are looking at. Is it clear, Mr. CK?
Yes, it's very clear, and that is why I wanted you to hint on that, because usually as Dynapharm members, we always rush to give a product that is actually the best product for a certain situation, but we forget the cleansing and blood and circulation bit of it. So I wanted you to explain that so that our leaders can know that it's important that as much as you are giving maybe the RH for the joints or whatever product for a certain condition, blood circulation plays a very big role in ensuring that that product works effectively. Yes, you have explained it so well. Thank you very much.
Welcome.
Any other question before we can bring in Caroline Juma from Mozambique? Hello? Hello?
Hello.
Hi.
Any other questions? Even if you have a supplement, please go ahead.
Hello.
Hi.
I think to add on Mr. Gershom's contribution, it's very much important to really focus on cleansing and detoxification of the system, especially colon cleansing, because a number of times, because of poor eating habits, most of the people have a stuffed colon, they have issues with the digestion system, and most of the times you find that our products do not work effectively just because of missing the best approach to managing a situation. So like you said, if we are looking at, for example, we are looking at a gynecology disorder, you may find that instead of somebody, taking straight, for example, Maharani, we may need to focus on cleaning and detoxification of our system so that the target product Maharani can be able to be digested, transferred until it reaches the target area. So when the blood circulation is not effective, the Maharani may be just flushed out of the system because of poor absorption and probably because of ineffective blood circulation. So you find that somebody may complain that the product did not work well, but simply because our approach or whoever was recommending the product focused on the target product rather than the mechanism of action. Thank you so much.
Thank you so much for that wonderful supplement. Any questions, submission, supplement, additions? Hello?
Hi.
Hello? Any question, any supplement?
Everything is
You can
clear,
unmute.
Mr. CK.
Yeah, if there are no questions or submissions, so any additions to the submission on blood circulation, maybe let's organize to go to the next presenter, who is Caroline Juma. Caroline, are you online?
I wanted to add something
Okay,
on
good
Mr. Joshua. Gershom.
Okay, Caroline, you can hold it there. Let's go to that addition before we can come to you. Please go ahead. Yes, someone wanted to make an addition. Please go ahead.
Yes, this is Ivan Kawari.
Yes, Ivan.
I only want to add to thank Gershom for a good presentation and knowledge. I also want to add on something simple about blood circulation.
Thank you so much.
As people get problems with swollen legs, many people forget something too simple about an infection. An infection can go through the urine and affect the kidneys, cells in kidneys. These kidneys may not balance properly or take blood directly through the feet and take fluids and blood through the legs. This may also lead to edema. So as much as we focus on only particularly on blood circulation, as the kidneys help in transporting and taking blood through the legs and the feet and fluids, we need to look at infection so that infection should not weaken the cells in kidneys for kidneys to be able to transport blood to lower parts of the body. So there, on pregnant women, as one of the colleagues said, as much as we need to let every woman, pregnant ladies, that they need to stay away from infection by using feminine wash always as a very good disinfectant and a probiotic to stay away from infection that may lower and affect the kidneys, which may interfere with blood circulation, and of course, leading to blood pressure. As a kidney getting a problem, you will automatically get high blood pressure. Because one of the functions of kidneys is also to balance blood pressure. You want to be able to help the heart without taking care of a kidney on the other side. Blood pressure will never be okay. So avoiding recurrent infections is one of the methods to improve blood circulation. I thank you.
Thank you very much, Dr. Feminine Wash, for that supplement. This time, I think let's go direct to Caroline, CDM. CDM, are you online?
I'm online.
Please go ahead.
Okay, good morning, Dynapharm.
Good morning.
Okay,
good morning.
thank you. I'm happy to present the topic I was given.
Use your product today.
CDM Precious, please mute your microphone so that you can get one.
Yeah, it's mute already.
Hello.
Okay. CDM, please go ahead.
Yes.
Hello.
Hi.
Okay, fine, thank you. Okay, I'm happy to represent the topic I was given. I was given the topic of the unique benefits of Dynapharm business, and this is a very good topic because as all of us knows that we are distributors of Dynapharm, and the first benefit that we get in Dynapharm is the registration fee. Our registration fee is too fair to us, and all of it come back to us in form of products, in form of catalog, in form of the bag, in form of the ID, and in form of fast track for opening our accounts. The fast track is opening our accounts to be distributors. So the whole money comes back to us. That is the first benefit that we get from Dynapharm. Then secondly, the second benefit that you get from Dynapharm, we have our directors, which are seeing the responsibility of transporting products from direct from Malaysia to our different countries and different DPCs, but still they maintain the uniform prices in the list of all DPCs, irrespective of the highest cost of transportation. This one helps us because whatever happens, like if I can take example of my country, Mozambique, I'm 2,500 kilometers from Maputo, but the products reaches where I am in Nampula at the same price that the distributors of Maputo are selling their products. That is the same price as in Nampula we are selling our products. So that is a great benefit to us. And since as distributors, we are not involved in the transportation.
CDM Carolina, we can't see on video. Can you turn on your video?
Thank you. Are you seeing me now?
Yeah, we can see you now.
Okay, I want to repeat the point I was talking about. I was talking about the transportation costs. What happens for us to get the products? Our directors are involved in transporting the products direct from Malaysia to our different countries and our different DPCs. And what happens is that DPCs are far apart from another one. So what happens is that they incur the cost of sending us products, but still we sell them at the same price. You'll get one DPC is selling the price at the same price as another DPC. So that one is a great advantage to us as distributors. Then another benefit that we have is that our company provides for us training rooms and qualified trainers. As distributors, we don't pay our training rooms. The company pays for us, and our work is to recruit people and bring them to the training room. And they're trained by qualified trainers. This is a very great advantage to us. What do our trainers train our distributors? They train our distributors on what? Product knowledge. Very important. And thanks for the trainer who was just training now. He spoke about that. Knowing our products is the basic of our business. Then they train us on what? Business manual. Please, my fellow distributors, let's take our time and understand what is in the business manual. Because unless we understand what is in the business manual, we'll forget that we are distributors. We'll forget our function as distributors. Because we are distributors, we are not workers of Dynapharm. So when we are distributors or we are professional business people, what is there is that we have to make sure that our business moves, and we have to know what we are supposed to do as distributors and what we are not supposed to do as distributors, because we are even allowed to register people internationally. So there's no way that you can say I cannot recruit people because somebody is outside the country. No, we have to sit down and understand who is a distributor. An active distributor has to qualify monthly. So if you don't qualify monthly, you are not equivalent to be an active distributor. And another thing that we should understand as distributors, we should be able to understand who is an active distributor and who is a consumer, because at times we recruit other people who are consumers and they want to buy at a lower price. So our work as distributors is to do what? To continue motivating these people, inspire them so that they can be able to qualify monthly the way it's supposed to be. Our trainers train us also on the marketing plan. If we don't, sorry, before I go to the marketing plan, the body system, and this is what our trainer was training us today. The last trainer who trained us spoke about it. We have to know the body parts. If somebody tells you, I'm feeling pain here, you have to know. And how can you know that without coming to the training room? We have to come to our training rooms so that our trainers, when they are training us on the body parts, we can be able to know where those parts or those organs are before we be able to go to the market to go and try to look for people to take our products. Then let me go to the marketing plan. I love marketing plan, and it is the best. Because marketing plan talks about our daily money that we receive. Because when I'm looking at the time that COVID-19 started, COVID-19, when it started, most people lost their jobs. And remember, us in Dynapharm, we are still recruiting, which means that we have space for more people, while others are sitting at home, as we are recruiting more people because we are in capacity of paying them their bonus. That is not a challenge to us. That is the best part of it, of marketing plan. And when we come and know our marketing plan, what are we going to do? We are going as leaders, we are going to produce even distributors or leaders who are professional in what they are doing. And through that, the company has given us, we have different general managers in different countries. We have MISs in different countries who are controlling and recording and managing the transactions that we do. And this one we get every month in our statements. So each and every leader or each and every distributor, you have to make sure that you learn and know how to read your statement. Then we come back to what? In our products. We have people in charge of products, which make sure that each and every DPC gets the product at the right time, and they know which products moves better in each and every DPC. And for my fellow distributors, please, we are talking about benefits of Dynapharm. Here, there's nothing like one product is moving and another one is not moving. Please, all the products have to move, because whatever happens is this. If we cannot be able to sell our products and they expire, which shows that we don't have capacity to have products. So this is the point that we should look at, we have to make sure that all our products, sincerely speaking, we have to try so that our products cannot expire, because expiring products shows that we are not in the capacity of selling that product, and next time we'll not have the same product. What will happen? Maybe if your customer got used to that product and the company can no longer produce it because that country is not having a position of selling it, that is very risky for us. So our distributors and my fellow distributors, we have to make sure that we move all our products and we get the retail and we get the BVs that we need from the products. Dynapharm.
Number one.
And this one shows us how organized our team is and how organized our company is to be able to hold hands of a distributor to grow in our business. Then another benefit that we have, our products are 100% organic. I enjoy taking e-garlic. I love e-garlic because when I just open that capsule of e-garlic and I pour the powder in my tongue, I feel the garlic itself. The smell is garlic itself. And I even enjoy swallowing like that, the capsule, putting it in my tongue. Why? Because I came to realize what is important in that capsule. Most of us like coffees, but there's something also we have to learn about our capsules. Our capsules are different, and our capsules, they are of another high level, because when we put in our tongue, it melts. The saliva, make it melt quickly, as quick as possible, because of what? The gelatin shells that we have in that capsules. It is totally collagen. And that one helps us a lot. The moment we'll realize what is in that capsule, I'm telling you, my fellow leaders, because I know everybody wants to look young. Each and everyone wants to look good. So if we come and realize whatever is in our capsules, the quantity of collagen which is there, and if people come to learn that part of it is beef, which is there, and not pork, I'm telling you, we are going to sell our products in high quantity. Another benefit that we have as distributors of Dynapharm is that as distributors of Dynapharm, there's nothing that says that this is the first distributor to register. He's favored to buy at this price. All distributors buy at the same price. The first person who registered and the last, or the person who has just registered today, will buy at the same price. They are all considered the same, only that in our marketing plan, I'm sorry, my leaders, but we don't tolerate lazy distributors. There's no way you can benefit from Dynapharm if you become lazy. I'm sorry for this, but this is the point that we really have to look at. If you cannot sell the products, I'm sorry, you are lazy. If you cannot attend the training room, I'm sorry, you are lazy. Because whatever happens is that we want to benefit. But first of all, what do we benefit from? Recruiting. If you recruit, you have advantage. Your team is growing. If you recruit, remember you are building a foundation down there, because this person will enter at the first track. And remember, the first track is the one that holds the pillars. So if your foundation down there is not prepared well, I'm sorry, my fellow leaders, you will complain in Dynapharm there are no benefits, but there are benefits. And remember, the recruitment, the money for, hello?
Hi.
Remember, the money, the fast track is the money without any competition. Because this is the money you'll be getting it from all the team that you've recruited. So please, my fellow leaders, let us recruit so that we can get advantage. Let us build our team so that they can be able. Hello.
Hi.
Let us build our team so that they can be able to sell in big quantities. Because if we can sell products in big quantities, what happens? We'll be able to get a good performance bonus. We'll be able to get good money for leadership. We'll be able to get good money for where? From the retail. We'll be able to get good money and their bonus. So the challenge that we have, why at times you can say Dynapharm, there's no money, because it depends with where we started the foundation from. And if you don't understand that we are sellers, the point is here, we are sellers to get money. We are sellers. I'm sorry, we are sellers and we have to sell. Another benefit, I've spoken about it a little bit. Let us train our leaders in a good manner. Thanks, Leader Iris. There's something you spoke about. You spoke about what? That we should train with love. We should love our distributors, the people that we've recruited, and not only the people that we've recruited, even those who are not under us. Because the point is that Dynapharm, so long as you're a distributor of Dynapharm, so long as I carry this box of Tonkat Ali in my hand and I start talking about it, if I say a wrong thing about this distributor, if another person will come to sell, nobody will buy that product. So please, when we are training our people, because you want to benefit from Dynapharm, let us not choose and start saying, this is my downline. I should train like this. This is not my downline. No. We should make a trend of where we are supposed to train our leaders, our distributors in a good manner so that they can give a good message so that the whole company can gain. Because to say the truth, who is the company? We are the company. Because we are the distributors and we are the ones who carry the message of the company. So this is another way that makes our company to be unique. Now, another benefit that we have as Dynapharm distributors is that there's something that happens in Dynapharm outside marketing plan. Outside marketing plan. And what is this? Point number one, promotions. Our leader, sorry, I speak Portuguese, so Portuguese is too much in the mouth, sorry. So what is there? Our leader, Iris, spoke about car promotion. Sincerely speaking, these promotions that we have that are running, if you come and look at them, they are outside marketing plan. That is the truth. I'm seeing this time of coronavirus. What is happening? COVID-19, what is happening? I've been seeing different countries awarding different things to distributors because like right now today, I'm seeing in Kenya, Thika, people are receiving funds. I saw the other day, Zambia was giving out things. Mozambique last month, we gave out fridges and cookers. And even this phone, the beautiful phone I'm using now that I was not even thinking I could own, an iPhone that I'm holding in my hand, worth $1,000 US. I got it from Dynapharm. So the company is really trying to give us promotion to promote our business. My fellow leaders, this is a great benefit, and we have cars. It spoke about cars. Like me, as a person in my own house, it has entered 4 cars in my house. The first car, I think CK is a witness, I received the first car in 2015 in Maputo. Then the following year, I received another car in 2016. 1 year. Then that was Land Cruiser Prado. The first one was Nissan March. Then after 2 years, I went home with 2 cars. I went home with the double cabin, and my husband also went home with the car. And behind me, because she said, don't win alone. Behind me, behind that car, it had carried 54 projectors and computers, and there are 20 people who won only computers, and there was somebody I got in the street selling airtime. So I trained this boy, and this boy managed to get $3,000 US. So what happens is that we should sit down and know that there are benefits in promotion, which is outside the marketing plan that the company gives us. And I applaud the company for that. Thank you for that. Then there's another benefit that we get from the company. We attend international conferences. Most of us, and I'm sorry to say this, I just want to say the truth. Some of us, we couldn't imagine that the kind of lifestyle that we have, we could ever enjoy that lifestyle. Some of us didn't know that you can be exchanging planes in a month, somebody like me. And I'm proud to say that I'm not sorry, because when I traveled from my country of birth to Mozambique, I came by bus. I started boarding plane in Dynapharm, and I think my first plane to board in Dynapharm was 2014. And that plane was taking me to South Africa, and not knowing that I should be at the airport 2 hours early, I went late. When I reached the airport, hey, people had already checked in. The plane was overtaken. And what happened is that my GM by that time, who was Alan Jendo, called me, and I called him and I told him, and he told me, wait, in 2 hours time, I got another ticket. And I went to South Africa the following day. So there are these things that we enjoy, because in the international conferences, we meet people from different countries, we interact with them, we understand how they do business. There are some things that we have in our native places that we erase from our minds after meeting other people, and we enjoy the diplomatic life that other people enjoy. Please, these are some of our benefits, and my fellow leaders, you can really, this one, there's no way you can deny, because everywhere where we go, the places that we sleep, the kind of lifestyle that we enjoy when we are in our international conferences is something that everybody admires. And when you go back home, the moment you reach home, even your family members start looking at you, and they can see right from your skin, it has changed. I'm just sorry, because this time of COVID-19, we cannot be able to travel. And this one makes me feel so bad, because I really need a holiday. We have other benefits also. What are these benefits that we have? We have what? We produce our products by ourselves. My fellow leaders who are able to travel with me in 2015 to Malaysia, before you do anything, remember when we reached Malaysia, at the airport of Penang, the moment you reach there, it was so emotional to get Mr. Hoy standing at the airport the whole night, waiting for the team to arrive. That, Mr. Hoy waiting for us at the airport, you reach there, and they are there. And they are there with the flag. Mr. Hoy is holding a flag saying, "Welcome to Malaysia." Who is this leader? Who is this, the owner of the company, who can stand the whole night at the airport, waiting for you, just a distributor, to reach there and welcome you without sleeping? This man worked the whole night. And after that, after receiving you, he could not go with you as a team, because I remember as team of Mozambique, we arrived there around 7 p.m. That was the time we arrived. Others arrived very early in the morning at farm. And when we see all the pictures, this man was there, this old man who should relax was there standing. Then we go to our G hotel. We prepare the following morning, we go to our factory. You start seeing the raw materials. The raw materials, you see them, you see what makes tonkat ali. You see what makes milk testo. You see the way they are washed. No hand washes them. You see how they are weighed, because those raw materials, when they reach there, that is money. Somebody uses money to buy those raw materials, while us here, we are waiting our respective countries to get what products. So the process they pass until they are packed, we saw them in 2015. And we went to all these factories. We went to the agro, we went to the cosmetics area, and we saw all this. we manufacture our products. We don't beg anybody to manufacture for us our products. And we were able to see this time of the epidemic, what has happened. All these countries, all these factories, or all these our competitors, let me use the right word, competitors, that they depend on other factories to manufacture for them products. Most of them don't have products because whatever is there, even if we look at our products, what happened in the company, they reduced the number of workers because people, sincerely speaking, people there in the factory should not be many. So the number was reduced with 50%. Now what happened? Who will produce for you products and they want to produce their own products? So this is another challenge that we've seen. Each and everyone should have their own producer, manufacturer. So this is the advantage we have. And our father, Mr. Hoy, is not ashamed to show us what he has developed. But even before the epidemic, we were supposed to go and visit our new factory, which we didn't go to visit. So these are real benefits that us as distributors and my fellow leaders who have ever traveled and seen this, let us talk about these benefits to our leaders, our distributors, and let us tell them the truth, because the truth, we know it. Challenges cannot be there, cannot fail to be there. Challenges have to be there. But what is there, we have to really talk of what is happening in Dynapharm. So my fellow leaders, I really beg you that we have to look at the benefits, and we really have to know that anything, if you want our business to grow, there's nothing that will grow unless we come back, as Iris said, we know what we are supposed to do. We know the advantages, where the benefits will come from, because there's no way how we can get benefits unless we work on the benefits. Thank you. Thank you, my leaders. I can talk up to tomorrow. Thank you.
Thank you very much, Carolina CDM, for that energetic presentation. I can see the goodness of Dynapharm runs in your blood. Thank you very much. I want to announce that our expert trainer, John Banda from Lusaka, Zambia, is already online. But before we go to him, if there's anyone who wants to supplement about the goodness of Dynapharm business, please go ahead. Any supplement? We know that Dynapharm benefits are many.
Can I say something?
All right, go ahead.
Yes, good afternoon, everyone.
Good afternoon.
Hello.
Hi.
Yes, I hope everyone is hearing and listening to me. I want to supplement on Carolina. What she has said is real. She talked about marketing plan. She talked about statement interpretation. And when I go back to marketing brand, if you don't understand marketing brand, you don't understand statement.
Hello.
Rogers, unmute, please. Rogers, unmute. We can't hear you.
Sorry.
Yeah.
I wanted to supplement on Madam Carolina, what she has said. It's real good. I thank you. My point is on marketing plan and statement interpretation. It's most of the leaders, you have neglected marketing plan and statement interpretation. You have focused on product knowledge. And in this case, I think everyone can sell, but after selling, how much am I supposed to earn at the end of the month? That should be the most important thing for a distributor to understand. So statement and marketing plan, they go hand in hand. If you don't understand the statement, it will be hard for you to understand the marketing. You first understand the marketing plan, then you go to the statement interpretation. Let's say, if I register 5 people in a particular month, how much am I supposed to earn at the end of the month when the bonus comes? If a distributor doesn't understand that one, it will be hard every time and again. He'll be complaining, he or she will be complaining that oh, the company is cheating on me. As leaders, we need to demonstrate, we need to teach our distributors, our downlines, marketing plan. It's the baseline where a distributor will be convinced that what I'm doing is right. Another thing is on top of that, before actually you go to marketing plan, a distributor, if he or she is new, he must understand the background, give the background, the chairman, the president, the countries of the countries where Dynapharm is operating, the certificate recognition. That's where a distributor will fully understand what he's supposed to do, because he cannot join the industry and all of a sudden doesn't understand what he or she is doing. So basically, marketing plan and statement interpretation should be our main focus as leaders, to make sure that at the end of the month, every distributor gets a smile. If not, it will be very, very hard. And remember, under Dynapharm, we share the opportunity. As leaders, we need to demonstrate the capability of sharing the opportunities. If you earn this month, you should share the same tactics you used to earn, to let's say in this particular month, to a distributor, to your downline the following month. If not, it will be hard. And as leaders, we need to be focused on that. I thank you for listening to me.
Yeah, thank you very much, Rogers, for your supplement. Do we have anyone who's supplementing on the uniqueness of Dynapharm opportunities?
Yes, good evening, good morning, leaders, or good afternoon, leaders. This is Cuthbert Kamkama from Uganda. I would like to thank CDM Caroline for our presentation and the rest of the previous speakers. I would like to talk about some few things. Among them are the literature we get from Dynapharm. If you look at the catalog is intermarried by the body systems guide. For a distributor to understand Dynapharm, you are supposed to be able to understand first the body systems guide, which will guide you into the product knowledge. For instance, the body systems guide will help you to understand the body itself, the diseases that affect that particular body part, and also the products that can be used to be able to tackle that problem, which a distributor is supposed to understand. Now, when you understand the body systems guide, it will guide you into the catalog for you to be able to know the actual product. Because what makes it a bit hard for some distributors is because they want to read the catalog first and forget about the body systems guide. So when they meet a client, it will be hard for them to combine the products to be able to give a particular client a combination of products, which is a bit of a challenge. So looking at it in the context of Dynapharm, it is very important to intermarry the body systems guide together with the catalog. And when you come to the business manual and the marketing plan, it's not a bit of easy to understand the marketing plan. But if you read the business manual, it will usher you directly into the marketing plan, and you'll be able to understand the marketing plan perfectly well. Just try and look at the business manual, read page by page, and look at the marketing plan. You'll see how they intermarry. But if you read the marketing plan without understanding the business manual, you'll find it a bit of difficult for you to be able to understand the marketing plan. So as you share with your downlines or your distributors, give them that kind of context and for them to be able to enjoy the business. And above all, there is a principle that I created that will help all of us as distributors or as leaders. That is the 5 Ps. What are the 5 Ps? One, this is product. The first P are products. That is product knowledge, understanding both the food supplements and the organic foliar plants fertilizer. This is the backbone of the business. To understand what you have as a leader, understand what you have as a salesperson, understand what you have as a downline of an upline, to be able to go out there to the field. And number 2 are the people. The people you're going to present to these products that you have at hand, after understanding the products. Because it is very difficult for you to go out there in the field and begin telling someone about chlorophyll without you as a leader understanding what chlorophyll is all about. Because you end up gambling. At the end of the day, you'll fail to make the sale to that person you're going to approach. And number 3 is the plan. Planning for that person whom you're going to show or present to the product so as to be able to what? To achieve after giving the person the product. So the planning matters a lot. Most of our distributors don't have planning. They wake up one morning and just say, we are going to the field. No, plan and see which people you're going to meet and which products you're going to present to. You can't go to the hospital with the DI group and say you're going to sell DI group. No, you want to make any sale. You get it? So you have to plan properly for the people and the groups you're going to meet so as to be able to make a sale and a perfect sale with Dynapharm products, which are very effective and having a positive result. And after that, we have number 4, the place. Understanding the places you're going to matters a lot. You can't jump from one village to the other without understanding that place, because you won't plan properly to meet those people to be able to sell to the products. And finally, it is the profit. We are all in, Dynapharm is a business. And at the end of the day, we are targeting to earn a profit out of a business. There is no business that does not like profit or does not, you want to enjoy it because of not having what? A profit. Because we all love profits as distributors, as leaders. But for you to be able to achieve all these is to understand the first one, the products, the second one, the people, the third one, the plan, the fourth one, the place, and finally the profit. And all these will be achieved after understanding the literature that you receive when you join Dynapharm. So please always encourage your distributors, always encourage your downlines to be able to go back into the drawing board, look at this literature that is given to them, let them read through, guide them and motivate them to read this product, see this product knowledge is here, this literature, the marketing plan, the business manual, the body systems guide. After understanding this literature that is given to them, they will be able to understand the business and they will be able to enjoy the business. That is why Mr. Oyehoicho said, when you're registering people, you register 5 people. Why did he say 5 people? He meant 5 people because you easily get in touch with the 5 people, you easily understand the 5 people, and they can easily duplicate what you're also doing into the business of Dynapharm. But if you register more than 5 people at once, it may be difficult for you to always follow them up. It may be difficult for them to duplicate what you're doing. But if the 5 duplicate what you're doing, the other 5 will duplicate what you're doing. And at the end of the day, you're all going to benefit and enjoy the business of Dynapharm. So that is why we say Dynapharm is always number 1, not by mistake, but by the glory of the Lord and by the business manual, by the marketing plan, which is very perfect, and by the organic foliar plus fertilizer that we have, and the beautiful and awesome products of Dynapharm, and above all, by the wonderful investors we have in various countries who have enabled us to push the business from one level to the other. I thank you.
Yeah, thank you very much for your submission. If we can hear from 1 or 2 distributors or leaders before we can move over to our expert from Lusaka, Zambia. Any leader distributor who has a submission addition to the benefits, the goodness of the Dynapharm opportunity. Dynapharm?
Number 1.
Number 1.
Dynapharm.
Dynapharm?
Number 1.
Number 1.
Number 1.
Hello.
Hello?
I come in.
Hi.
Yes, please go ahead.
I really want to appreciate this meeting for today that basically the main training I'm seeing here. I want to start by thanking CDM Iris from Botswana. It was a great privilege for your presentation. You really brought out what a real leader should be in Dynapharm. And it's so motivating and encouraging to find that we still have people who believe in leadership. To my own understanding, I feel a leader is someone who can see how things can be improved and who rallies other people to move together and better. And to me, again, a leader should be able to have a vision and try to make it reality and putting people first, because you can't lead tables, you can't lead chairs. And I really appreciate CDM you brought in action, how to lead people the right way, how to build each other. It was so nice. Thank you so much, CDM Iris. I want to thank Gershom for the definition of what it means to have proper blood circulation in our body. He really brought it out in his medical way and his background, and we really appreciate and we hope the team, that the consultants that we have learned so much and we can be able to expound. I believe Dynapharm has been a school for us, a university for us, a secondary for us. People have got degrees and bachelors, and I mean, you can talk of PhDs when it comes to Dynapharm. Thank you so much, CDM Caroline. It was such a nice presentation to know that we have such good people who have such good knowledge and information, and we always need to continue and share this kind of information. I remember Caroline said we shouldn't let products expire. It's such a nice statement. We should never let any product expire, because you also know that we have one advantage of Dynapharm on how products intermarry or are interconnected for different diseases. Thank you so much, Carolina. Yes, I believe Corona will get us out and relieve us, and we all head to a new factory in Malaysia. Yes, it's already up and working, but I think it will be upon us and when to get there. The team from Gabon, great apologies for what has been happening, because it has been a very big challenge, but I believe the container is yet to reach Gabon, Libreville. And we hope you'll get out of the fear and the scare. Remember, Dynapharm is strong and it will always be strong. My leaders and the team we are working with, I want to ask you something that always remember. Run away from negativity and people who are negative in your life, because they can actually divert your vision as a leader, and you find you're actually discouraged in what you're trying to do. And two, my leaders, again, I want to ask you kindly to lead people the right way and make them understand what you do and what you have benefited. Otherwise, stepping one company and another doesn't help us. Infightings in business does not help us. The love and care, forgiveness on the heart, and you know that, yes, someone did something wrong to me. Yes, it doesn't mean you trust the same person again. It doesn't, but please forgive and forget, and we move on, because business, and mostly Dynapharm has taught us that we have to be together, whether we like it or not. There are those who you'll find out there, they say this one is selling Dynapharm, it doesn't work. Please be strong and focus on yourself. There are those who you'll even have in Dynapharm and they don't believe in you. Keep it to God, and God will always encourage you and give you a right way. Mr. Colin, I want you to allow me to usher in Mr. John Banda, my friend from Lusaka, a great motivator, a trainer, a leadership skilled person who has been training in different, I looked at your profile, Mr. John Banda. I was very shocked to know Dynapharm is so blessed in this way that we actually rub shoulders with people of this kind of strength and magnitude. And we hope we shall learn from you, Mr. Banda, and hope again, we shall have you again, because as we are talking, I want to again request even the distributors, please, next week on Tuesday, we have the same training. We have another guest speaker from Kenya and two other guest speakers from different countries. The guest speaker will be not from Dynapharm, but we shall have two other surprise trainers. Please encourage your people to make sure they attend. For the general managers who are here, please make sure these trainings from today, Tuesday and Friday, are broadcasted in your training rooms. We all have very nice projectors and very nice training places. We should have these trainings well broadcasted, and other people can view and see what you are actually communicating to them. For those of you who are going to be trainers next week, we hope you can prepare early. The topics will be sent in to you. And for Rogers, please make sure you prepare that presentation very well. You've started it well, and I think that's the reason why we want you to train these people to understand that they have lost so much money in not understanding the marketing plan and their statements. Thank you so much, Cuthbert, for the motivation. Mr. John Banda, you're welcome. Please, you can have your microphone and take us on. Thank you so much.
Thank you so much, my brother, and good morning, everyone. Can you hear me?
Yes, we can. Good morning.
Yes, we can hear you, sir.
Good morning.
Good morning.
Good morning.
Yes, good morning,
sir. Yeah, it's great to be with Dynapharm once again.
John, can you unmute? Just a minute. Hello? Okay, can you bring him back on?
Okay, can you get me?
Yeah.
Okay, I didn't mute. I think the host accidentally muted me. Okay, it's great to be with you. Thank you so much for inviting me once again to present. I'm really, really grateful. Dynapharm is a very great organization. It's always a pleasure for me to work with Dynapharm. I feel a sense of pride every time I'm working with Dynapharm because of the work that you are doing, especially to enhance people's livelihoods, not just in terms of wealth, but also in terms of good health. So I really feel very proud to be associated with you in terms of training. Okay, by the way, the previous presenter, what's her name again? The lady who was presenting, what's the name again?
Carolina.
Carolina, great speaker. I am amazed. I am so amazed, such a great speaker. I enjoyed your presentation. I joined you late, but I enjoyed it. You speak with a lot of wisdom, energy, and motivation. So that was a very great presentation. You have motivated me, Carolina. I'm very motivated by your presentation.
Thank you.
Wonderful. So in the interest of time, I was asked to speak on teamwork and also communication. I think I'm going to start mainly, I'm going to combine the two. My concentration will be on teamwork because I feel that is everything when it comes to business performance, especially today where there's a lot of disruption globally because of the COVID-19 and also because of competition. There's a lot of competition, especially in network marketing. A lot of companies have come up. So the only thing that is going to set Dynapharm apart, and the only thing that is going to enable you to outperform your competitors isn't so much great products. Most of your competitors are coming up with products similar to your products. Most of your competitors are coming up with services similar to your services. The number one thing that sets companies different from their competitors, the number one attribute that sets the leading companies, leading businesses from other businesses, mainly it's culture. The culture that is common in that organization. The culture that is different, it's like human beings on earth. In Africa, we are all, mostly we are blacks, but what makes Zambians maybe unique, what can make me identify someone from Kenya, for example, isn't the complexion, but the culture. So it's the same with businesses. What is going to make Dynapharm the market leader, not just the market leader, but the profitable market leader, will be a unique culture. A culture is the way a company behaves, the way people behave. So what is going to make Dynapharm different in these disruptive times? It's not the products. You have got great products, trust me. You have got, because I've taken some time here in Zambia with the leader here, when I was doing training for them, to just ask, I was asking the people I was working with about your product. So I know you have great products, but the behavior of your people, your behavior as a people, the way you operate, your culture, that's what's going to make you different. Particularly, there are basically three things that make great entrepreneurs. Let me just share them with you before I talk about the 4 stages of a team, so that the underperformers, for lack of a better term, under Dynapharm can know where they are. So 3 things make great entrepreneurs. Number 1 is attitude. Attitude. I heard the other contributor say, avoid negative people, avoid negative-minded people. That is attitude, and I agree with him 1001%. So in disruptive times, in these competitive times, one of the things that you must look for and also develop in yourself as a leader is to have a positive, for lack of a better term, a positive is very common nowadays, but a possibility mindset. For example, Carolina was talking about the places that she's been to, the cars that she's won. So all she's trying to do is to show you that whatever goals that you have set or you are setting as a team or as an individual, they are possible. So in disruptive times, it's not the times that make companies underperform, because there'll always be bad times. There'll always be competition around. Those will always be there. 1930, there was competition. 2021, there's competition. 2022, there will be stiff competition than ever before because of technology. Small companies are going to come up and make the same products you're making. But what will make Dynapharm a great performer is the attitude of the people who are working with Dynapharm. After all, the people you are working with, they don't buy your products at first. They buy the attitude, they buy the people selling the products, because products don't sell themselves. The people who are selling the products sell themselves to the people, then the people, the customers, they buy the products. So customers, they don't buy products. Customers buy the people carrying the products. So if the people carrying the products, they have a negative attitude, and you can always tell a negative attitude the way someone is talking, in the voice. Maya Angelou, a great American lady, the philosopher, artist, I think most of you knew her. She said that people will forget what you say. They'll forget how you said it, but they'll never forget how you made them feel. They'll always remember how you made them feel. So it's very important as a team, as you go out to sell there. Remember, the first thing that you are selling are good feelings. That's the first thing. So the question is, how do you feel yourself about Dynapharm? How do you feel about the products? When you are mentioning the products, is there energy in your statements? Is there a belief? Do you believe in what you are selling? Do you believe in the value you are providing to people? Do you believe that Dynapharm is the best company in the world? You have to really brainwash yourself when it comes to that. I was working with a company, British American tobacco company. I was doing training for them here in Zambia. And I discovered most of the executives believed in cigarettes. They believed in smoking almost religiously. When you are visiting the offices during lunch and during tea breaks, they'll religiously be smoking there with the sense of pride. See, but that's an unhealthy product. That's a product that is killing millions of people. But they have a sense of belief in them that will make you want to start smoking, even when you don't smoke. So my point, as Dynapharm, you are selling life-enhancing products. The question is, do you believe in the product? Are you bringing life to the products? Teams are not really groups of people. You see, you are not a team because you are a group of people who have come together. You are a team because you are a group of people with a mission. That's what makes a team, the mission. So what is the mission? Even when you come together, what is the mission? And I'm going to share just briefly with you some of the common things that are going to strengthen your teams, are going to strengthen you as Dynapharm or as a team. So very important, have a positive attitude. Believe that this is the best company in the industry or in the world. Make everyone begin to believe in what you believe in. In other words, don't just be a consultant. You know, consultants are very smart, which is very good. You must be smart. You must have product knowledge. That's very good. A lot of people have probably the same product knowledge that you have. But I want you to move beyond being a consultant. You must become an evangelist of Dynapharm products. You see, an evangelist is someone who believes in a certain message. He has a mission to take to the world. And so he takes it out there, wants to convert people to believe in whatever he or she believes in. That's the same spirit that you must have as leaders at Dynapharm. Embrace the energy and then take the energy out there. When you walk in a room, you must exude energy, and people must ask you, you're at the airport going to Malaysia for a holiday. So people must ask you, they must stop you and say, not only do you look rich, but you are so full of energy. This has nothing to do with how much you are earning. I mean, there are rich people who are miserable. There are drug dealers who are miserable because they are selling a product they don't believe in. Drug dealers, they know that what I'm providing is destroying lives. But you see, it's not about the amount of money you are earning. The amount of money comes from your belief. So if you believe in whatever you're selling as Dynapharm, whatever your value you're creating and providing to the world, what will happen is, even when you are walking, you will walk like someone who's on a mission, and people must stop you. Even on a plane, when you're on a plane, don't read any other magazine. When you're at the bank, carry a Dynapharm brochure, wear a Dynapharm shirt or t-shirt, branded t-shirt or shirt. The power of believing in your mission is that everything around you becomes a statement about the mission you believe in. So attitude is very important. That's what will set you apart as a team. Now, the second thing which is very important is aggressiveness. I call them the 3 A's, by the way. So attitude and aggressiveness. How aggressive are you? See, aggressiveness, aggressive business people, aggressive sellers, salespeople, aggressive consultants. They don't knock on the door once and say, you know what, it's COVID, the markets are closed, I can't do this. Aggressive people find means and ways to get the job done. To be aggressive in these COVID times and in these competitive times, you must combine flexibility and agility. You must combine the two. You must be flexible, find means and ways to win customers, because that's the whole purpose of a business. So find means and ways to win customers, but also be flexible about it. You see, flexibility is the willingness to change your approach. The way we were doing business last year or the other year probably would have changed. And not just because of the COVID-19, but also because of competition. If your competitors are doing the same things you are doing, what will make you different from your competitors? You will just be the same with your competitors. So very important. So flexibility is the willingness to change. And agility, are we together? Agility. Flexibility is the willingness to change, and agility is the speed of change. So most of you are willing to try new approaches to win customers, but also you must be fast about it. And the last thing that you must do, I'm talking about the 3 things that make successful entrepreneurs. The last thing that you must do is your appearance, very important. How many times do you post? How many times does Dynapharm products and adverts show up on your Facebook page? I'm talking about appearance. So have a positive attitude, be aggressive, find means and ways. That's what aggressiveness is all about, to win customers. Find creative means and ways. Do something new, do something crazy, do something surprising. Go to the club. Most economies are open right now. The Zambian economy is open. So if you're watching me from Zambia, go somewhere, go to the club, carry your products, carry Dynapharm samples or brochures. As you are having a drink there, show them. Church, when you're at church, after Sunday service, after prayer, show your neighbor whatever that you're doing. Recruit someone. You see, you don't recruit away from your circle. So teamwork has to do with these three things: attitude, aggressiveness, and appearance. How often does your product appear on your timeline, let's say on Facebook? How often does your product appear in your home when people visit your home? What's on your product? Very important. So attitude, appearance, and aggressiveness, very important. Now, let me just talk quickly about 4 stages of team performance so that you can know and be comforted in case you are not where you are. So these 4 stages are going to help you to identify where you are as a team and what you need to do. So the first stage of the team is called the forming stage. You know, the forming stage, F-O-R-I-M-I-N-G, F-O-R-M-I-N-G. Forming, as you know, you form a team. So the first stage of team performance is the forming stage. So here, this is where most new members join you, on the forming stage. Members are happy, most of the times, members are happy to come together because they have heard a story from Carolina, how she's earning thousands of dollars. So they are not joining because of growth motivation or because of the process of winning customers. Here, they don't understand the process of generating the thousands of dollars, but they are happy to join because they've heard stories about Dynapharm. So most members join because of that. But you see, when you are not aware of the process, your team members are not going to perform. So this comes to the second stage. It leads us to a stage called storming. So from forming, usually teams get to the second stage, which is called storming. S-T-O-R-M-I-N-G. When storms come, for example, no one was expecting the COVID-19 to hit. So some of your new team members, when they joined, they were expecting to get paid without doing much, probably. And then it was made worse when COVID came. And so what happens? Performance plunges on the second stage. Performance plunges. And here motivation leaves you, especially when you have got a leader who doesn't communicate shared values, shared plans, shared goals, and performance evaluation and appraisal. I'm going to get back briefly to those things that are going to make your team strong. So it's very important as a leader to communicate. In fact, the best way to communicate as a leader is to, first of all, tell people the expected results. You have to communicate to your people, these are your expected results. To your expected results, these are expected rewards. Clarity is very important when it comes to communication. Clarity, very important. Even when you are criticizing poor performance. By the way, never criticize the performer as a leader. Criticize their performance. In fact, one of the best ways you do it, if you want your team to perform very well, always start your evaluation and appraisal with praise. Because you know when you are told that you look good, especially ladies, and even gentlemen, when you're told that you are looking good, you feel good. So if you want your team members to perform as a leader, first of all, start by communicating their strength. Praise them. So you can maybe call Imelda and say, you know what, Imelda? Your performance in January was very, very good. These are the results you produced. It was very good. One of your strengths is you are a very good salesperson. You're a good communicator. This is very good. But as from February to date, your sales have been very poor. So when you are evaluating and you want to coach your people, always start by praising their current performance. And then criticize the performance, the poor performance. And then end by praising them again. So you can tell them, I believe that you can do better. You are strong, you are gifted, you are a good communicator, you are smart. That's how you do it. So performance under the storming stage plunges when there are no team goals. This leads us to the third one, which is called the numbing stage. Numbing, things get to normal. So from the forming, we come to storming, and then we come to norming. So things here become normal when you communicate to people your story. Storytelling is very important. Storytelling. Don't just tell people your successes. One of the things that causes teams to underperform is when we divorce processes from results. For example, if I earned $10,000 or $50,000 last year, I need to explain to my team. I motivate them, this is how much I'm earning, and I coach them, this is how I do it. By the way, one of the best ways to communicate is to tell people what you are about to tell them. Then tell them, and then tell them what you just told them. Very important. Tell people what you're about to tell them, then tell them, and then tell them what you just told them. So when you are motivating people, one of the best ways is don't even just use money, but also use vision. Communicate to people, this is how you do it. This is where you're expected to be. So when you are communicating with people, communicate the results expected, the rewards, if they perform. These are the rewards that are expected. When you fail to perform, these are consequences. This is what will happen when you don't perform. Not that I will punish you. The system will punish you. The market, you will be broke. You have to do this almost every week, once a week, either on a Monday or on a Friday. Very important. So clarity, conciseness, very important when it comes to communication. So the norming stage here, performance begins to pick up under the third stage called the norming stage. How does performance picks up? Performance picks up when you identify and you coach people based on their strengths. That's when performance picks up. And I'm just going to share briefly with you in conclusion on the things that are going to make your teams very strong. Then the last stage, of course, is the performing stage. The team starts to achieve real results when, as a leader, you communicate with them. In fact, one of the things that you must do as a leader is to over-communicate. You can never under-communicate as a leader. As a leader, you must develop your people. You just don't run and focus on your goals. Because remember, as a leader, people are the top line that determines the bottom line. Your people are the top line that determines the bottom line, the sales, the profit, the results. So how do people perform? People are very petty. People perform when they are praised. People perform when they are mentored, when you focus on them. When you tell a wife that the meal you cooked is delicious, she will seek to prepare a more delicious meal tomorrow. So when you tell a team leader, even just $1, they achieve a sale of $10, you call them, you celebrate. See, the rewards don't have to be money only, monetary. Words are powerful. Words are powerful. The words of a leader, they are powerful. People will do more by you using words. They'll produce results by you using words rightly. But if all you do is to tell your people to say, you know, you can't do this, or you are unable, or you have failed, they will not perform. So very important. How do you motivate people? Use psychic rewards. And psychic rewards are praise. Praise them publicly. Praise them immediately. They make a sale. Don't keep quiet about it. A $10 sale, a $5 sale. Praise them as if they have achieved $1 million sale. Why? Because people are spirits. I mean, even God created the universe with words. People are spirits. And when you develop people with words as a leader, when every time you meet as a team, you inject inspiration in your team will always seek to do more. That's how people are. But even when you are giving people a lot of money, but you are not doing it strategically, you are not doing it with words, and you are not adding positive words to it, they are not going to grow. So as a leader, over-communicate. Treat people, talk to people as if they are $1 million earners. Communicate with people as if they are $1 million earners, as if they have brought in millions of dollars worth of business. Communicate with them that way. Then they will surprise you. They will bring those kind of results. So in addition to product knowledge, what psychologists have discovered is that people always perform well when they feel great. So criticize the performance, not the performer. But remember to communicate. So communicate expected results, communicate expected rewards, communicate also expected consequences should they fail to perform those results. So now, I just want to share with you in conclusion, just a few things that are going to strengthen your teams or strengthen you as Dynapharm. First of all, number one, shared goals. Very important, shared goals. So you need to know where you're going. 6 months from now, what do you intend to achieve? 3 months from now, what do you intend to achieve? I mean, a goal is very simple. A goal is simply an end result you want to produce. That's a goal. A good way to set a goal as a leader is from X to Y by when. That's a better way to set a goal as a leader. So don't just say, January, we must succeed. No, how you put it is, our current performance is at $50,000 as of 14th October 2021. Our aim is to move from $50,000 to $250,000 by January in sales. From X to Y by when. That's the best way to set a business goal. To set a business goal, it has to be measurable. From X to Y by when? From X to Y by when? From October 14th, $50,000, we move to $250,000 by January 2022. Your team members' minds will have an idea, will have a map, and they'll have a clear number to aim at. So a goal for your team must not be small so that it doesn't challenge them. People are always moved with big goals, with challenging goals. That's what drives performance. When you put a goal, you set a high goal, people are moved. Now, the goal shouldn't be impossible. I'm not saying it should be an impossible goal, but it should be big enough to motivate them. Very important. So shared goals. Now, I didn't say a goal, but a shared goal. So if your goals for your team are seated behind your desk, they are not team goals. If you are the only one who's aware of the goals, they are not team goals. So communicate the goals constantly. I think you see Coca-Cola always advertises their products. Always advertise your goals to your team. Always advertise your goals to your team and the rewards attached to the goals. And number two, shared values. These are what is going to strengthen your team. This is exactly what will make your team bond together. Shared values. What's your mission statement? Can you recite the mission statement of Dynapharm in your sleep? At 02, can you define the mission of Dynapharm? When you're waking up at night, you're fast asleep, can you recite it? See, your team needs to internalize what Dynapharm stands for. Because remember, what will set you apart from your competition is not just the products, but it's how the products are delivered, how the relationships with your customers are managed, and much, much more. These are called values. What are the core values of your team? What are the core values that you have agreed upon? In dressing, in advertising, in how you carry yourself as a Dynapharm consultant? What about in answering customer queries? What about in communicating with customers? How often should we communicate with customers? Product delivery. If you go to some pizza company or Pizza Hut, they'll tell you that the pizza will be ready in 5 minutes or it's free. It's a value. What makes a pizza company different from another pizza company, it's not so much the pizza. The pizza is a product, but the way the pizza is delivered, those are called business values. As Dynapharm, constantly, especially new members who are just joining you, when you recruit a member, focus on the new member more than you are focused on the old members. I mean, it's human nature to always want to associate and communicate with the old members because you're familiar with them. But remember, as a leader, also don't be too familiar with your people. Focus, invest your time in the new members. Give them leaflets, communicate with them the mission, the values, ask them how is business, coach them, this is how it's done, and you discover that they will be sold out. They will be part of the team in less than 6 weeks. From shared values, we go to shared plans. What is the sales plan? What is the sales process? How do we sell the products? How do we deliver the products? What are our weekly plans? What are our annual plans? You need to communicate those with your team members. And what are the rewards attached to the plans? So from shared values, we come to shared goals, and then we come to shared plans. Every team member must not only know the plan, but must contribute to the plan. When you contribute to the plan, you are committed to the plan. When you don't contribute to the plan, you say, it's not my plan, it's my boss's plan, it's my team leader's plan, it's not my plan. So always ask for input from your fellow members of staff or the people you are working with, your fellow consultants. And the last one is clear leadership. The second last one, sorry, clear leadership. So leaders, they learn about people. Everyone in your team must know who is a leader, not by title, not by status, not by earnings. Because remember, as a leader, your performance is determined by the performance of your people. How your people perform, that's how you perform. So how will your people perform? Your people will perform when you make them feel important and you focus on them. Get to know them by name. Get to know them, get to know their challenges, get to know their successes, get to know their strengths, their weaknesses, their markets, get to know the opportunities those markets present. As a leader, have hands-on information. For example, if you're dealing with people in Zambia or you're dealing with people in Uganda, you need to know, as at now, how is the Ugandan economy performing? Get to know by demographics. If someone tells you they're in Kampala and business is not doing great in Kampala, as a leader, you need to be able to challenge them and say, but as of last week, the Kampala economy was the fastest growing economy in Uganda. So you challenge the people. Why? When your people know that you have a command of the facts, they are going to respect you and they are going to like you because of a positive attitude and because you know. But you see, when people like you as a person, they are going to respect you. But when they love you as a leader, they are going to follow you. So what you want is for your people to follow you, to respect you, and then to be inspired to produce the results that you want them to produce. And the only way you do that is when you get to have a command of the facts. The devil is in the details. That's what they say. The devil is in the details. So get to know where are my people and their location? How is the population there? And the population of farmers, how is it? What about the obesity levels in that area? How are they? And what products can we send there? What products should we concentrate on? Which products should we move? Which products will sell more? And the only way you will know that is when you communicate with your people. Because if you're not communicating with your people, you won't have little data. You see, Google gives you big data, but people give you little data. And in business, what you want is to have both. You want to have a map of the territory, what's happening. You know, you want to have a stellar map, an area view. but also you want to have the specific little details of how your market is, which products will sell, which products won't sell, so that you are not experimenting. And of course, the last thing, in conclusion, what will make your team strong, very important, is continuous evaluation and appraisal. So get to evaluate your people, their performance, and then also get to understand what do they need. Practice Kaizen, continuous and never-ending improvement. And the only way you get to understand and to implement Kaizen, continuous and never-ending improvement, the only way you get to do that is when you have hands-on information concerning their performance. And that happens when you're continually evaluating and appraising your people. That way, you will know their strengths, their weaknesses, what resources they need, both intellectual resources and also should they need moral resources or financial support and much, much more. So in the 21st century, in the digital age we are living in right now, leadership is not so much, command. It's not so much that you tell your people, no, the best millennials today, the best way to lead them, give them a picture of these are results that I expected. And you can do these things, you can achieve these things. And then develop strong bonds with them, strong relationships, mutual relationships by communicating the results, make them feel good, and you will see them perform very well. Some of the people you're working with are not working for money, by the way. Some of the people you're working with, they'll just want to work with Dynapharm because it's a brand, it's a global brand. Some of the people you're working with, they just want to be part of a team, part of a family that is doing big things and great things in the world there. And the money will probably just be supplementary. The big monies will probably be just the rewards for being part of a winning team. But you see, you can never achieve a dream without a team. You can never do that. So find out what motivates each and every one of your team members by listening to them, ask questions and listen to them. Ask them, what are your goals? What are your personal goals? See, use what I call the P.O Go formula. Ask them, what are your personal goals? Ask them, what are your organizational goals? Then ask them what obstacles are standing in the way of you achieving these goals, and what opportunities can we avail to you for you to achieve your goals. They will be able to surprise you. I think I can talk for 3 hours, I can talk for 5 days. I was just in Kamu doing a training for USAID for 3 days, and I presented 3 days nonstop, apart from at night and tea break sleeping. So I'm going to end here and leave room in case there are some questions, and I'll be glad to respond to them. Hello.
Hi.
Hi.
Thank you very much, Mr. John Banda, for that powerful presentation. We have learned a lot.
Thank
that
you
is
so
why
much.
we have been silent throughout the presentation. I'll throw it to the leaders. Please, if you have a question for John Banda, please unmute your microphone and go ahead. Thank you. Please, any questions? If you have a question, please go ahead.
Okay, thanks a lot, Mr. Banda. Me, I don't have a question, but I really appreciate you really opened my mind, and thanks for the presentation. I really appreciate. Thank you, and we'd like to have you more. Thanks a lot.
Thank you as well for the positive feedback.
Good morning, Dynapharm.
Good morning.
I also don't have a question, but I want to thank Mr. Banda. But actually, I want to thank Mr. Director for inviting his friends to come and address us today. I'm grateful that I'm part of this meeting today. I'm not alone. I'm leaders here, we are having a meeting here in South Africa in Welcome. So we decided before we continue with our meeting, we should be part of this. And I don't know, I'm just grateful that we are part of this meeting, and we promise you, Mr. Banda, we are going to be different. I think you have just fired us up. This is what we needed to hear as leaders. Thank you so much, sir.
Thank you as well.
Hello.
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 Please go ahead.
Yes, thank you, Mr. Banda.
Yes.
Please apologize. I'm French speaking. I'm not coming from an English speaking country. And at least I have a question. But before to ask my question, it will be to congratulate this powerful presentation. And I think that it has turned around all my body, all my mind, my blood, and it is coming in the same line with the presentation of Mr. Gershom and the ones of others. Then I thank you a lot. I thank you so much. At least my question is about trainings, not trainings, especially trainers, because for me, when I've joined Dynapharm, I was so interested by this part of Dynapharm, because Dynapharm is a company where trainings are very, very powerful. And now for you, such a leader you are, can you tell us exactly which advice or what can you give or advice to trainers? Because we also know that trainers, they are like also the backbone in our business. As soon as we have very good trainers, I'm very sure that trainings are going to be good, and also we are going to improve our business. Then for you, what can you advise to trainers, especially right now? Thank you.
Okay, I don't know, was that question directed to me or to the director? I think it was directed to the director.
No, to Mr. Banda, to you, Mr. Banda.
Ah, okay. So your question is, what can I advise trainers?
Yeah. Yes.
What can I advise trainers to concentrate on?
Yes, to concentrate on and to improve the trainings.
Okay. I think the first thing, the first challenge that most trainers have, I would say, is they are relaxed. Most trainers are very relaxed. I interact a lot with trainers, and they depend on past trends, past information when it comes to preparing trainings for their staff. But you see, in the digital world today, markets are very fluid. In other words, markets are changing very fast. In fact, almost every second, markets are changing. So training, what I can advise trainers is make your training to be market driven. You make your training for your people to be market driven, to be market reality driven. It must be based on market needs. It shouldn't just be academic, but it should be based on where the market has evolved to. For example, right now, because of COVID, people are mostly selling using technology. So trainers must be able to research and find out how do you sell in the age of digital technologies, for example. How do you do that? For example, as a trainer myself, I think the director here in Zambia is very much aware of our digital platform. During the COVID-19, we created digital platforms for entrepreneurs to sell online as they are home. And every day, more than $10,000 is changing hands, is transacted through our digital platform. Why did we do that? Because we observed the market reality. So my message to trainers is that forget about past strengths. In fact, as a trainer, forget about what happened yesterday. As a trainer, always be forward looking to what is about to happen next. What's about to happen next? Always ask yourself that question as a trainer. What's about to happen next in the business world? What's about to happen in the population? What's about to happen technologically, socially? What's happening? How are people eating, for example? How are people exercising? What about the weather? The geospatial information is available right now through Google Geography. So you need to have market knowledge, market reality knowledge, both socially, technologically, politically. Always ask yourself, what's the next thing that's about to happen in the world, in the business, on the market? Always ask yourself that. I can take all day to respond to this. By the way, to everyone watching, you can follow my page on Facebook so that we constantly interact also online, you know. You can follow my Facebook page, go there, you can like the page. The name of the Facebook page is John Banda Motivation. John Banda Motivation. That's the name of my Facebook page. So go there, let us constantly also interact.
Maybe Mr. Banda, if I can come in.
Yes.
I like the way my brother posed his question on what do you advise on trainers in terms of them making themselves better or improving their business. And I have at least somehow been talking about this, and I'm happy you've brought it out. We're in a different modern world and era whereby the digital world is taking us, and we all need to get digital. And being digital doesn't mean we have to get into the computers and know the inner side of the computer.
No.
It's about getting to know what social media platform you can use, or whatever platform you can use to actually up your game. So just like Trezor, you asked, I would even have said, Trezor, make sure you duplicate what we are doing here now in Comoros, so that maybe if here we are doing it international on Tuesday and Friday, then you should have your own trainings on Wednesday and maybe Thursday or Monday in Comoros, and you do the same thing and you duplicate it with your management team, and you can be able to do it. What other thing can you do if we are to have these kind of trainings on every Tuesday and Friday, just like Makatio has done in Welcome? Then we should have clear presentations and screens are all showing, and in the training rooms, people can communicate. What we are trying to do now at the moment is to make Africa a small world to live in through communication, which exactly Mr. Banda is talking about. Not only the trainings online, can you actually use your page like he said? How many articles you have been seeing how we, as a company, we're trying to make sure almost every day or 2 days, we have a post on Dynapharm products moving. But you as a trainer, because people believe in you, people trust in you, how many times do you post out some information? How many times do you wake up in the morning and you talk about that coffee that you're drinking and post it with your phone? You don't mind about the quality of the phone. Just use the most important thing is the information. So to my own maybe extra information to Mr. Trezor is, can we up our game? I have seen you doing some other good different things in Comoros. The next trainings, I think you also scheduled for your training. We hope you will share with us on how you're creating those trainings and how they are improving in Comoros. Thank you.
Great. Very, very good. Very, very great. Yeah, I do agree with him. Very great contribution. So as a trainer, always be, you must have what I call digital threads. You must always be accessing trends. As a trainer, most of the information trainers are using right now to train people is obsolete. It's useless. You need right now to be constantly creating new material, which is reality-based, market-based, concerning what's happening. For example, millennials, how are they spending? The young people today, where are they spending time? What are their highest priorities? What customers needed yesterday might not be what they need today. Also, how they needed it might not be how they need it today. But if your training is stuck, in 1992, and it's based on what people needed in 1992, you are not going to empower your people. You are going to actually disempower them. It's like, the blind leading the blind. But if you're training, because your eyes must be open if you're going to lead people. So if your training is based on what's happening now and what's about to happen tomorrow, what customers need now and what customers will need tomorrow, what will happen is when you train your people, your training will be results oriented, not just academic oriented, but results oriented. That's what I endeavor to do, by the way. Personally, I make sure that whatever training I'm providing to my clients, it must produce results immediately. It must produce results immediately. Whether I'm training an insurance company, I'm training Absa Bank, I'm training British American Tobacco Company, I always want to make sure that the training is not based on what happened yesterday. Because as soon as an experience has happened, customers don't need it. Customers need what they need now. Therefore, your training must prepare your people to meet customer needs immediately. Yeah.
Colin, are you there? Where the modulator, Colin? Any other leader with a question, please feel free to ask. I want to take this opportunity to thank Mr. John Banda for your presentation today. I want to take this opportunity again to thank the leaders I've seen from Lesotho, Swaziland, much as you have some issues happening, but we are praying for you. I've seen a team of people from Mozambique, Maputo, Nampula. I've seen people from Zambia, Philly. Thank you for attending our trainings. People from Burundi. I saw CDMs from Rwanda. Thank you for coming in. I've been seeing, I think, Moses online, Gabon, Equatorial Guinea. I saw some gentleman from Senegal who was online with us. Thank you, everyone, for coming to be with us today. And we hope next week on Tuesday, you'll be part of the training and we shall be having different topics and different people. And we hope to continue and expound on knowledge and share so much. I hope patients soon you'll be on the list of trainers. I hope Lindy Way, you'll be part of the trainers. Am I seeing? No, it's not. I hope Seboko, you'll be part of the trainers. I saw her there on the list. The team from Burundi, also Comoros, I saw some people at Trezor, I think, with your team. I saw a team from Mauritius. Thank you so much for being here today. I think we have tried to be in our time from 11 to 2 p.m. I don't know whether, Colin, you're still online and you still have more information to make. And if not, then I will want to thank everyone and say, may God bless you and wish you the best and take care. Good luck. Dynapharm?
Number one.
Yeah, we have
Number
Mr.
one.
Banda here something to say. Mr.
Number
Banda.
one.
Yeah, I just want to say something.
Number one.
Hello? Yeah.
Bye.
Yes, Mr. Banda, I can hear you. You can come in. Okay, yeah, so you can please go to my Facebook page, like the page and comment. I've just posted the poster for Dynapharm there. Yeah. So you can go to my Facebook page, John Banda Motivation. Thank you. Yeah, thank you so much. Go to my page. Yeah.
Any other issue, any concern, any question, please feel free in the next 2 minutes as we finish at exactly 2 as agreed, and we wish you the best. Any other question?
Hello.
Hi.
Hello.
Hi. Hello.
Hi. Yes, this is Pastor Joy from Botswana. It's not a question. I just want to ask if I missed something. When Mr. Banda started, he talked about what makes our company unique. And he mentioned, number one, he said culture. And then we moved to what makes a great leader. So I don't know if I missed when he went back now to list the what makes our company unique after the culture.
Okay, so can you get me?
Yes.
The culture was an introduction.
Okay.
And what makes now culture were the 3 things I talked about, which are attitude, aggressiveness, and appearance.
Okay.
So you are, yes. So culture is the way you behave. As Dynapharm, your behavior must be different from other companies in terms of how you win customers, how you provide value, and all that.
Okay.
Yeah.
Thank you so much. Thank you so much.
Okay.
No, I thought maybe they.
Yeah, but if you want more clarity, if you want more clarity and more questions, please drop me any question that you have or clarity that you need on my page. Are you getting me?
Yes.
Okay, so if you want more clarity, drop me a question on my Facebook page, John Banda Motivation. Just inbox me the question. Due to time, I'll be able to respond to you nicely so I can understand your question.
Thank you so much.
Thank you so much, Joy. Sorry, I want to also thank the team from Botswana that is online. Thank you also for attending. South Africa, also the team online. My apologies for not recognizing those 2. And any country that is online that I haven't recognized, my apologies. Comoros, I know you're there. Burundi, you're there. For now, we wish to close the training session today. And as he has said, we have a page, which is Dynapharm International, in case you need also still to ask something more or to post something, or you feel you need to say something also on the training, you can always post on our page. That is the DNG live presentations. If you are not on the DNG live presentations, please ask your GM or the MICs. Every country is well represented with not less than 10 people. We have a DNG live presentations where you can actually always push your presentation that you want to discuss or your testimonies. Dynapharm? Dynapharm?
Number one.
Dynapharm.
Number 1?
Dynapharm.
Wish you the best and may God bless you.
Thank you.
Bless you too.